I feel it's time to really privatize this system, to get competition in the system. I don't want to socialize medicine at all. I don't think the government's been very good about getting us passports. They haven't been very good about closing our borders or controlling our borders, if you will. I'm not the least bit convinced that they're going to be able to handle an entire healthcare system. American people are pretty creative and pretty ingenious. And I think if we open this thing up to a little more competition, and we are going to have some really significant tort reform, I think we can control the cost. I think we can knock 30% out of this thing. If you knock 30% out of the cost of medicine, which I truly believe we can do, then I think everything changes. I think the whole thing is subject to reform then. Then you can have people start looking at buying their own health care. And rather than doing it through the employers and this and that, this hodgepodge patchwork of bureaucracies that we currently have, let's let every individual buy their own health insurance. We'll give them tax credits. We'll give them stipends if they need them. Whatever we need to get this done, I think if we put it in the private sector and we let the brilliance of the American people work through this, I think we can come up with an affordable, capable system that will appeal to both patients and physicians. The quality will automatically go up. We'll involve the citizens at a higher level. I just think there's unlimited upside to this, and I think we'd be silly going the socialized way. We've seen what that gets.
So you're talking about health savings accounts?
Health savings accounts can be a part of it, certainly. That's part of it. But I'm literally talking about people buying their own insurance policies and shopping for it.
What about those who just can't afford it?
If they can't afford it, we'll give them money. We'll give them vouchers for health care. You can give, we're paying for those people anyway.
And how good would that health policy be that they're buying? Would they be buying it from the private sector?
They buy it from the private sector. And they could buy it anywhere in the country. We remove all these state regulations, and if you want to buy it from Rhode Island, you buy it from Rhode Island. If there's a better deal in California, you buy it from California.
So which people cannot do now. You would make it available so a person from Illinois could shop the nation for insurance and not have to buy from a provider within the state, which is as regulations currently have.
Right. I mean, if you look at the more you regulate something generally, the less cost efficient it is. We need to take some regulations off here. We need to let people have more choice.
What about the argument, though, that some would say if you do that, you haven't solved the issue of what are the private insurers then going to cover? What about the argument that the insurance companies are still making the decision then of what's covered and what's not, and therefore it's insurance people and not doctors making the decision on the quality of health care?
Well, I think that the insurance companies will end up providing the consumer with choices that they want. This is going to be a competitive market. If I want to sell you insurance, I've got to sell you a product you want. I've got to try and figure out how to make it a price you can stand.
Would you not, though, let's say if somebody needed a liver transplant, just to pick something that's not an everyday occurrence, we might, under such a system, have great coverage on the run-of-the-mill things, but would we be leaving some of these life and death coverages that are going to be expensive, like a liver transplant or a heart transplant, because maybe those just aren't going to be profitable?
Well, that's up to you. Do you want to buy coverage for that? There's certainly a place for some regulation in this, and I'm not suggesting a total free-for-all. But what I'm suggesting is that you buy the health care that you think is better for your family or yourself, and not have it dictated to you as to what should be included in this policy. Let's let them go. Let's let the insurance companies meet the consumer directly with the physician's guidance and assistance and come to a reasonable variety of policies that we can use, that we can offer. Let the patients choose their policy and work with their physicians to take care of their own health.
Because you're a doctor, I once said, give us an insight to what's happened with you as a practitioner of family medicine over the last, how long have you been practicing?
25, 30 years, somewhere in there.
What kind of changes? I mean, what's the bureaucracy? What's the impact? I think all of us have some sense of what it's like on patients because we're all patients. We're not all doctors. Give us an impact on what the current system is doing to doctors and the quality of care you can provide.
Well, I think the current system is that we find hands are often tied for patients who can't get insurance. This is a very difficult thing. Somebody comes in the office, they really have a problem that needs to be looked at, and they say, well, I might have insurance in 4 months. Let me get back to you on that. It's not a 4-month waiting period on this problem. And it's a real, because, you know, you're 52, you lose your insurance, you change your job, you've got nothing for 4 months or 6 months or 8 months or 12 months while you try and get a new job. That's unacceptable. You have to be able, people have to have a portable insurance policy that goes with them between jobs and everywhere else. And we have to make this workable. And we've got to cut down all the bureaucratic nonsense that I put up with. Nobody wants to hear about all the nonsense that doctors go through.
Actually, that's part of what I wanted to hear, though.
Well,
Senator Durbin or Senator Obama won't be able to tell us on the inside what it's like. And maybe those are also some of the changes. Maybe some of the bureaucracy and the headache that doctors are put through that arguably may lead to whatever figure you want to use. There is something along the lines that over 100,000 people a year die in hospitals needlessly from accidents and mistakes. This is tied into the argument you made earlier about medical malpractice to bring those rates down. But on the other hand, when we've interviewed the trial lawyers, they say we're needed as part of the system because doctors make mistakes. What's happening on the inside the bureaucracy of and how is it impacting medical providers?
Well, what we see as one of the most disturbing things is people telling us exactly what to do and constantly taking our time for that. I get multiple sheets of paper every day that say, did you know your patient was on this drug for this long? Well, yeah, I do. Okay? Then they say, do you know that's not supposed to be that way? Well, you know, you can't just have some guy tell you exactly what's right for which patient. That patient needs to be on that drug right now.
Who is it that's telling you this?
Insurance companies.
Insurance companies.
Yeah, I mean, they've expanded their role to the point where they want to practice medicine. I don't think so. I don't think it helps. You know, they asked me, did this little piece of advice help you in your practice of medicine? I can very comfortably say no. It did not help me one bit. It did not help my patient, and it took a lot of time for me to fill out your paperwork. I don't think that's what doctors should be doing. I don't think it's what nurses should be doing. I think we need to take care of the patients. We've really almost been kind of partially excluded from the process, and that doesn't make any sense. It's that person-to-person contact that drives that doctor-patient or nurse-patient relationship that's so critical. And here we're kind of legislating ourselves out of it, and it simply doesn't make any sense.
This is the kind of issue we could spend an hour on by itself, so I don't want to get bogged down just on that. But
I understand.
Clearly, on the other hand, you have interesting perspectives from both sides. You're a patient,
yes.
You're a doctor, and we'll look forward to hearing.
And I'm a small business owner who has to buy insurance. Another interesting perspective. Small business owners are out there trying to buy insurance for their employees, and they're doing less and less of it because it's become so costly and so difficult, so confusing. If we don't simplify this process at some point, I don't know what's going to happen. Maybe then we'll just socialize it, but I just don't feel comfortable with that.
As we record that, the UAW is in negotiations with the major auto companies. We see some of our major corporations struggling with the cost of health care now as a major issue and being competitive on a global level.
I think it's a critical issue, actually, and I'd like to spend just a moment on that.
Sure.
We've got to get this out of the employer realm. This does, in fact, affect our ability to hire people and run our businesses in this country, both large and small. Our large businesses and our small businesses are competing on an international basis. And here they're saddled with these huge costs of healthcare in this nation. And it makes them less viable. It makes them less able to retain work in this country. We want good jobs in this country. I think one of the pieces is you're going to have to do something with healthcare.